So the topic for today is the use of smartphone applications in the NICU. The specific learning objective is to make one aware what apps can do, that is the utility of the apps, to know how to get the apps, the sources and the affordability, to know the ease of use, that's the feasibility, to know the different platform for apps, that's the specificity, and to make one appreciate the loss if one doesn't use the technology. So moving ahead, so the prime thing is to orient and to encourage the doctors and the nurses in an ICU for the use of smartphone apps. So to begin with, since this is an era of digitalization and mobile and the digital health has become a norm. So I would just want to brief about two terms, that is the e-health versus the m-health. So e-health is the healthcare services which is being provided with the support of information and communication technology, such as computers, mobile phones, satellite communication for health services and information. Whereas m-health is the mobile health, which is referred to the use of smart or the portable devices for the health services and information. Application or apps, these are the programs which deliver the healthcare related information to healthcare workers in a coherent manner so that we can help in the management of the patient and minimizes the medication errors and also enhances the access to the point of care tools for better and faster clinical decision making. So this is one of the studies in 2008, although it is old, but it still holds true. So this shows that there are errors related to medication, which was seen in 313 cases, whereas in this incorrect medication was out of 313 in 15, incorrect use was in 4, incorrect doses in 208, and error in administration in 81, and underuse of medication in 5, and errors related to treatment procedures was 62, and errors related to clerical procedures were 82. So now this shows that the medical errors are too much and we need to minimize it in order to have a better patient outcome. So is it acceptable? Obviously no. So moving ahead, so this is one of the reasons that we should use apps to prevent the professional errors, to practice most effective up-to-date neonatology, ready access to knowledge and skills, as well as the procedures. Who needs apps? So the beneficiaries are the doctors, which includes all level of seniority, nurses, parents, community, and anyone who wishes to be informed, efficient, and effective in life. What apps can do? So these are some of the advantages, that is the accessibility to information with the broad spectrum, saving time and facilitate the evidence-based decision-making, enhancing the workflow and documentation, remote monitoring and telemedicine, education and training, research and evidence gathering, and of course, the convenience and portability. So these are some examples of free versus the paid apps. So these are the, this is the list of the paid apps, the Neonatology, which costs 300 rupees, and the users are airway, intubation, emergency medicines, calculations, umbilical line. What it doesn't include is the anti-seizure medication, and the gestation-wise, gestation is not mentioned, and gestation-wise treatment methodology is not included in this. Then there's an Oxford handbook. This is way too costly. NICU Neonatal Intensive Care Unit test as an educational app. So this includes the practice test, study cards for the nurses as well as the students. Then we have the Neonatal Intensive Care Unit NICU, which uses again the practice test, study notes, and the flashcards. Then we have an NICU Neonatal Intensive Care Unit Exam Review app. Then we have a phototherapy calculators. We have phototherapy by the NICE guidelines. We have Essential Neonatal Medicine 5th edition. Then we have Neonatal Resuscitation, Cranial Ultrasound, Neonatal Formulary 7th edition. Now, these are the list of the free apps. So the first one is the NNFI Shishu, and this is just only applicable for the Android, the NNF CPG, the Santa NICU, Neomate, Neonatal AI, Complete ABG, ENRI, Complete ABG Analysis. And the last four with the Neomate, Neonatal AI, Complete ABG, ENRI, and Complete ABG Analysis, both for Android as well as Apple. Now we have categorized the apps into three: the point of care utility apps, educational apps, and productivity apps. So point of care are the ones which involves the measurements, the calculations, the drug formulary, treatment of the jaundice, and the list goes on. The educational apps, it includes the practice material, question banks, the flashcards. And productivity apps, this involves the monitoring of the feeds, the growth parameters, about the breastfeeding, developmental milestones, then for the trainees in maintaining their daily activities, as well as for the private practitioners to include all their daily activities can be noted. So moving ahead, so for the measurements and calculations, we have the neonatal AI, Neomate, Neolic. So this includes the size of the ET, UAC, UVC size, distance, emergency drug infusions. Then we have the online calculators for Apgar scoring, Ballard score, TPN calculators, and the growth charts. The few of the apps which includes other MedCalc. Then we have MDCalc, NICU tools, up-to-date, Medscape calculator, amongst the few. So this is one of the, we have the NICU tools. So in NICU tools, so it comes like that when we open the phone, and then we have a Medscape calculator, then we have a MedCalc. So these are few of the calculations app. Then we have apps for neonatal jaundice. We have a phototherapy, we have phototherapy calculator, we have Billy app, Billy Guru, Billy Baby, Billy tool, amongst, and there's a long list to go again. So this is one of the example of a Billy tool. So this is how we enter all the details, and we can find it out whether what is the range and what is the interventional range, when to start. Then we have for the sound and light in an NICU environment, we have a noise meter and a sound meter. For light measuring apps, we have a lux meter, we have smart lux meter, we have illuminance. Then we have for the fluid calculations and TPN, we have Neolic, we have neonatal fluid calculator, we have NICU calculator, TPN, Neo TPN, dextrose calculations and calories, newborn fluid therapy. So these are the few apps. So moving ahead, for the neonatal resuscitation, we have an NRP app, we have neonatal resuscitation, we have ENRI, we have Life. This is a simulation training application. NRP Vitals we have, which can be, which is again a simulator-based application, which can be connected through the Bluetooth as well as the Wi-Fi devices. We have SimOn, which is again a simulator-based app. So out of these, the Indian app is the ENRI one. So this is a ENRI app. So suppose we have a preterm baby, and so the preterm baby less than 36 plus 6 weeks. So it shows us the pre-resuscitation team briefing to be done, to note the time, receive the baby in pre-warm linen. And then they ask the question, is the baby breathing and crying? So if the baby is not crying, then we have to cut the cord, do not dry, the baby to be wrapped if less than 38 weeks, and to perform the positive pressure ventilation for 30 seconds. So this is how it is operated. Then we have, for the interpretation of the arterial blood gases, we have a complete ABG app, which is both for iOS and Android platforms. And this is again an Indian app. So this is the app with the interpretation. So we fill the pH with the PaO2, FiO2 with PaCO2 and bicarb, and it is going to show us whether it's a metabolic acidosis and the respiratory acidosis. So then we have the drug doses. From the drug doses, we have Neomate, we have the IBM Micromedics Neofax, we have drug doses, the paid apps, which involves Lexicom. Then we have a Harriet Lane Handbook. This is again a paid app. The British National Formulary, which is again a paid app. Then we have some educational apps, NNF CPG, the AIMS WHO comprehensive care. So this is the example. This is a NNF-CPG. So these are the questions. And this is also, the best part is that this is also going to give us the evidence-based. This is an evidence-based app. So suppose this is for the breastfeeding in preterm neonates. This is going to give us the recommendation, the strength of recommendations, and the quality of evidence. Then we have the productivity apps. This is for the monitoring of the feeding, growth parameters, developmental milestones, as well as for the trainees in maintaining their daily activities. So this is one of the examples, the Shishu Poshan. And so these are some of the questions which they can answer for us. So like different methods to hold a baby. So say, for example, we type a modified cradle method. So this is going to show us how to do it and the steps of as to how the position need to be held. Then these are some of the commonly used apps in the NICU. So we have an NNFI Shishu. The only drawback is that it is only for the Android. So this is the main page. So we have neonatal calculators, antimicrobial drug calculations, then non-antimicrobial drug calculations, continuous infusions, neonatal scores, the neonatal charts. So suppose we have a neonatal calculator, we move on to the nutritional calculator, and then we move on to the GIR to percentage of dextrose. So we are going to write the total fluid rate needed and the GIR. This is going to show what is the amount of dextrose which is needed. And it can further even calculate how to make this 20% dextrose. Then we have a neonatal AI. So this is the home page of AI. It involves calculators, charts and scores, checklist, and the infographics. So one by one, we're going to see this. So calculator. So in calculator, this is a couple of lists which we get. And suppose we type umbilical lines. So we are going to just write the weight, and depending on that, we're going to get the amount of the depth of insertion. And this is also giving us the pictorial representation of how the course is. Then we have the checklist. In the checklist, suppose we write PIC line. So we have this checklist, and we can actually feed this data in our mobile phone. And this can remind us also in the time of the completion of the days. And then we have the infographic. So this is going to tell us the pathophysiology in a pictorial manner. So suppose the pathophysiology of the hemodynamically significant PDA, then they're going to show us this in the pictorial so that it's easier, time-saving, convenient for us. Then we have charts and scores. Suppose we have clicked the Thompson score, then we are going to fill the determinants, and we are going to get the score according to that. Then we have a Neomate. So this is a home page of Neomate. Suppose we click the cooling criteria, and we get the cooling criteria. So this is a AIMS WHO app. Now this app this is a home page which includes the emergencies, the history examination management, and the appendix. So in the emergencies, suppose we click, and this is the second page which comes, and say we click seizures, and then we have the management of seizures. So this is the management of seizure, and suppose the seizure still continued. So this is further going to guide us. So what are the limitations? As my friend has already discussed, but we need to check the authenticity of information in the apps, the parental undue anxiety based on info in apps, cost, and the availability on the different platforms. So where are we as a neonatologist? So based on using the apps, we need to grow, we need to become the leaders. And this is also utmost national pride or a national excellence, a matter of national excellence. Then if we don't use the apps, we remain static, we remain followers, we would decay and crib. So the challenges in implementing the neonatal apps, the challenges are the educational needs. So the healthcare providers need to be trained to use these apps for proper monitoring and information gathering. Then the storage capacity is another challenge. So there have been concern about balancing the data storage capabilities versus the server costs. Then integration with the electronic medical records. Some electronic health record system can be incompatible with the newer apps, rendering them unable to interconnect, leading to the insufficiencies. So the future of neonatal apps. So increased integration and interoperability is one. So the apps will increasingly integrate with other tools such as electronic medical records and communicate with other devices and would form a more streamlined system. Then we have advanced analytics and machine learning. With the machine learning technology, the apps may become even more efficient and personalized, facilitating early diagnosis and intervention and leading to improved patient outcomes. Better connectivity for the rural areas. As the neonatal apps are affordable, easy to use, there would be a greater push towards expansion in the remote and the rural areas with poor access to health, the areas with the poor access to the healthcare facilities. But as our sir always says, that the clinical medicine is supreme. Technology is just to be used to facilitate and not replace the arts and science of the clinical medicine. So the conclusion is that it's the time to buck up and develop an individualized app, which is going to fulfill all our requirements and needs. So in summary, the revolutionary, its neonatal apps has revolutionized the neonatal care as a whole. Beyond monitoring, it is offering the practical solution in the patient care, digital communication with an easy to use interface, and also the promising future. The future development in this relatively new technology, it demonstrates promising prospects that will continue to advance neonatal care for the years to come. So my acknowledgement for this presentation is the book, Holistic Concept of Neonatal Nutrition. We have a chapter in that with apps in the field of neonatal nutrition, then holistic care of newborn and mechanical ventilation. Then the articles, the Our Medical Apps, the Future of Medicine, then current status of apps in smartphones and OBGYN observational study, and apps in neonatology. So thank you and have a good day.